Thank you for coming and seeing me today. How are you feeling? What you may be experiencing is major depressive disorder. It affects you both physically and mentally, so it's not just a mental illness. So, along with your depressed mood and lack of interest, you must also experience 5 of the following symptoms for at least 2 weeks. These being appetite change or weight change, insomnia, hypersomnia, fatigue or loss of energy, feeling of worthlessness and guilt, or decreased concentration. So when we feel stressed, our body releases cortisol from the hypothalamic pituitary axis to induce our natural fight or flight response. In normal patients, the release of cortisol can be regulated. However, imagine with yourself the stop switch is broken, so for turning off cortisol. That's what depression feels like. Although serotonin has been commonly known as the happy hormone, the exact effects and relation of serotonin in major depressive disorder is still unknown. However, serotonin is definitely involved and has been used as a biomarker for major depression. Hence, the most common form of treatment of depression aims to prevent the reuptake of serotonin. This prevents the breakdown and temporarily increases its concentrations between synapses. So I'm going to prescribe you with a drug called Vortioxetine. It's considered an SSRI, so that's a selective serotonin reuptake inhibitor. Basically, it works by blocking some of the types of serotonin receptors and enhances others to maximize the amount of serotonin present in your body. So Vortioxetine has fewer and less severe side effects than other antidepressants. The most common of these side effects reported are nausea, diarrhea, dry mouth, constipation, vomiting, flatulence, dizziness, and sexual dysfunction. Vortioxetine cannot be used in combination with other medications, such as other antidepressants, as this can produce a potentially life-threatening drug reaction known as serotonin syndrome. We do not know exactly how Vortioxetine mediates cognition, but it may be as a receptor antagonist at the 5-HT3 and 7, where it may impact neurotransmitters like glutamine and acetylcholine. Studies on Vortioxetine's mechanism of action have defined the drug as being multimodal. The clinical trials undertaken in assessing the efficacy of Vortioxetine in improving depressive symptoms have obtained similar results, using similar primary and secondary outcome measures. One of the most common primary outcome measures involves the use of the Montgomery-Åsberg Depression Rating Scale, which is a 10-item clinical rated scale that measures the overall severity of major depressive symptoms. Initially, Vortioxetine statistically failed to meet significance versus placebo in the primary efficacy analysis in week 8 in short-term studies. However, efficacy was eventually demonstrated in the long-term analysis in week 52. In 2016, a study concluded that Vortioxetine was 5.1 times more likely to be responded to rather than discontinued due to adverse effects. So specifically, Vortioxetine has shown relatively low rates of sexual dysfunction in major depressive disorder trials and statistically greater improvements when compared to other antidepressants. However, some studies have also concluded that although the withdrawal rate is lower, the remission rates of Vortioxetine are unfortunately higher than other antidepressants. It is estimated that 7 to 9% of adults will experience a major depressive episode annually. From those who report they've had an episode, over 77% of them stated that they had reduced workplace productivity. This, along with the cost of treatment, has significant economic impacts on our society. Therefore, Vortioxetine is essential in treating major depressive disorder, as it is a major problem that we face in our society today. One of the forms of data collection that is used to assess the impact of major depressive disorder on the workplace is the Workplace Limitations Questionnaire. These studies demonstrated that Vortioxetine as a first-line antidepressant consistently shown it can improve cognition in patients. Therapeutic trials have shown that a dosage of less than 5 milligrams a day in adults for a time period of less than 8 weeks have proven ineffective. Therefore, for the time being, I'll be prescribing you 10 milligrams a day. Thank you for seeing me today. I'd like to have a follow-up appointment with you in a few weeks just to see how you are responding to the Vortioxetine.